Good morning, team. As we prepare for today's surgery on Mr. Anderson, I want to ensure we're all aligned on the procedure and potential complications. This is a complex case with a history of both diabetes and hypertension.
Right, Mihira, and given his elevated blood pressure readings, we need to monitor his vitals closely throughout the procedure.
Exactly. But I'm also concerned about his diabetes. It could affect his wound healing post-surgery. We need to discuss our approach to managing his blood glucose levels during the operation.
Should we consider administering insulin before the surgery, or would that interfere with the anesthesia?
That's a great question, James. Administering short-acting insulin before we start might actually stabilize his levels, but we'll have to time it carefully with the anesthesiologist.
And what about the risk of infection? Should we increase our antibiotic prophylaxis, Mihira?
Yes, given his diabetes, we should certainly consider that as part of our preoperative protocol. Let's ensure we have the correct dosage ready.
Mihira, I want to explain what might be happening with you and why the doctors want you to stay in the hospital. Based on your symptoms, it is very likely that you have a kidney stone that has moved from your kidney into the ureter. The ureter is the small tube that carries urine from your kidney to your bladder. When a stone gets stuck there, it blocks the flow of urine and causes the intense pain you are feeling. This is why going to the hospital is so important right now. The doctors need to relieve that blockage and help manage your pain properly. Once you are settled in the hospital, the medical team will first do an X-ray or maybe a CT scan. This is to find exactly where the stone is and how big it is. Knowing this helps them decide the best way to remove it. In most cases, they use a laser to break the stone into tiny pieces so it can pass out of your body naturally. This is not a big surgery with cuts. It is a simple procedure. Open surgery is very, very unlikely for a kidney stone. The doctors will take good care of you, and the most important thing right now is that you are in the right place to get better.